This video is intended for educational purposes only. The Vestibular Ocular Motor Screening Exam was developed and validated by the University of Pittsburgh Medical Center. It is our goal that we can help other allied healthcare professionals learn about this important aspect of concussion evaluation and management. The VOMS exam should be used in conjunction with other concussion evaluation tools such as symptom scoring, understanding of previous medical history and concussion history, and neurocognitive testing. It should never be used as a standalone assessment. The VOMS is designed for use in patients age 9 to 40. When used with patients outside of this age range or immediately following injury, interpretation may vary. This exam is not validated for sideline use.
This vestibular ocular motor screening takes practice. I encourage anyone who views this video to practice these tests on both healthy and concussed patients so that you can familiarize yourself with the exam. Based on my experience, use of this screening tool is often the best way to convince an athlete, and perhaps yourself as a clinician, that the athlete is indeed concussed. Prior to starting this examination, it is important to ask about the patient's baseline symptoms. In this case, baseline is prior to the assessment, not prior to concussive injury. Symptoms queried should be headache, dizziness, nausea, and fogginess on a scale of 0 to 10. Abnormal findings or provocation of symptoms with any test may indicate neurologic dysfunction.
It is suggested that you have a tape measure, metronome, and a target with 14-point font to complete this exam. The Smooth Pursuits evaluation tests the ability to follow a slowly moving target. The examiner and patient are seated. The examiner holds a fingertip at a distance of 3 feet from the patient. The patient is instructed to maintain focus on the target as the examiner moves the target smoothly in a horizontal direction, 1.5 feet to the right and 1.5 feet to the left of midline. 1 repetition is complete when the target moves back and forth to the starting position, and 2 repetitions are performed. The target should be moved at a rate requiring approximately 2 seconds to go fully from left to right and 2 seconds to go fully from right to left. The test is repeated with the examiner moving the target smoothly and slowly in a vertical direction, 1.5 feet above and 1.5 feet below midline for 2 complete repetitions up and down. Again, the target should be moved at a rate requiring approximately 2 seconds to move the eyes fully upward and 2 seconds to move fully downward. Record rating of symptoms of headache, dizziness, nausea, and fogginess after the test.
All right, I'd like you to watch my finger, and I'm going to watch your eyes. Keep your head perfectly still. Now I'm going to ask you to rate your symptoms on a scale of 0 to 10, 0 being none, 10 being the worst. Headache.
1.
Dizziness.
3.
Nausea.
5.
Fogginess.
4.
An abnormal test is indicated when any symptoms are provoked or worsened from baseline. Next, the examiner will test the ability of the eyes to move quickly between targets. The patient and examiner remain seated.
I'm going to want you to look from one finger to the other with your eyes only. Keep your head still. Move your eyes as quickly as possible as you move from target to target.
The examiner holds 2 single points, their fingertips, horizontally at a distance of 3 feet from the patient and 1.5 feet to the right and 1.5 feet to the left of midline, so that the patient must gaze 30 degrees to the left and 30 degrees to the right. As with Smooth Pursuits, assess headache, dizziness, nausea, and fogginess after horizontal saccades.
Ready? Go. Good. Now I'm going to ask you to rate your symptoms again on a scale of 0 to 10. Remember, 0 is no symptoms, 10 is the worst symptoms. Headache,
4,
dizziness,
6,
nausea,
3,
fogginess.
4.
Next, the examiner will assess saccadic movements vertically. The examiner and patient position stays the same, except the clinician moves his fingers to 1.5 feet above midline and 1.5 feet below midline.
Once again, keeping your head still, I want you to look from one finger to the next. Move your eyes as fast as possible, but keep your head still.
As with horizontal saccades, repeat this movement for 10 repetitions and then assess headache, dizziness, nausea, and fogginess on a scale of 0 to 10.
Again, those symptoms. Headache,
3,
dizziness,
1,
nausea,
4,
fogginess.
6.
Good.
Convergence measures the ability to view a near target without double vision. The patient is seated and wears corrective lenses if needed. The examiner is seated in front of the patient and observes their eye movement during the test. The target on which the patient is focused should be 14-point font.
Hold this stick at arm's length, focus on the target there, the X, and I want you to slowly bring that towards your nose. When you see 2 of the X's, 2 of that target, I want you to stop, and then I'm going to measure the distance from the stick to your nose.
A normal score for convergence is 6 centimeters or less. If you notice any outward deviation of either of the patient's eyes, have the patient stop moving the target and measure at that point.
All right, we're going to do that 2 more times. So bring that back to arm's length again, and bring it slowly in.
Convergence is assessed 3 times, a measurement taken with each attempt. Only focus on double vision of the object. Blurriness is ignored.
Now.
Good. And one last time.
Now.
Good. Now once again, I'm going to ask you to rate your symptoms on a scale of 0 to 10, 0 being none, 10 being the worst symptoms. Headache,
5,
dizziness,
2,
nausea,
3,
fogginess.
1.
The VOR, or vestibular ocular reflex, assesses the ability to stabilize vision as the head moves. The examiner and patient remain seated. The same 14-point object is held 3 feet away from the patient at midline.
Now I'm going to have you focus on the target. When I start the metronome, I want you to move your head from side to side, keeping your eyes focused on the target. We're going to do 10 repetitions. Good. Now let's wait 10 seconds, and I'm going to ask you to rate your symptoms on a scale from 0 to 10. Headache,
5,
dizziness,
7,
nausea,
6,
fogginess.
4.
Good.
This test is now repeated with the patient moving the head vertically. The head is moved in an amplitude of 20 degrees up and 20 degrees down.
When I start the metronome, I want you to move your head up and down in a vertical fashion. Again, keep your eyes focused on the target. Good. Now let's wait 10 seconds, and I'm going to ask you to rate your symptoms on a scale from 0 to 10. Headache,
5,
dizziness,
4,
nausea,
8,
fogginess.
6.
Good.
This exam assesses visual motion sensitivity and the ability to inhibit vestibular-induced eye movements using vision. The patient stands with feet shoulder-width apart, facing a busy area of the clinic. The examiner stands next to and slightly behind the patient so that the patient is guarded, but the movement can be performed freely.
Extend your arm and focus on your thumb, and then you're going to Extend it out straight, and you're going to rotate your whole torso from side to side, 80 degrees to either side. You want to move as if your head, your arm, and your trunk are all in one unit. I want you to start when the metronome starts. You can do 5 repetitions.
As with the preceding tests, assess headache, dizziness, nausea, and fogginess on a scale of 0 to 10.
Good. I'm going to ask you to rate your symptoms again on a scale of 0 to 10. Headache,
5,
dizziness,
4,
nausea,
3,
fogginess.
7.
Good. Thank you for taking the time to watch this video. Again, we hope that with proper practice and understanding of this exam, you can use this tool as part of your concussion evaluation and management regimen.